Good morning. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. We are announcing one new case of COVID-19, bringing our total of confirmed and probable cases to 21. This was a gentleman in his 40s who lives in Winnipeg. Public health investigations are ongoing and continuing to identify whether this is related to travel or not. As of yesterday, over 4,500 tests have been completed at Chatham Provincial Lab for COVID-19. There were 278 tests done yesterday. Due to a worldwide shortage of reagent, Manitoba is prioritizing testing to those most at risk. This includes testing from First Nations, individuals in hospital or long-term care facilities, as well as healthcare workers. Chatham Provincial Lab is working on a solution, and we hope to be able to increase testing later this week. It is important to remember that there are other viruses still circulating, such as colds and influenzas. If someone has mild respiratory symptoms, we're still advising you to stay home. Wash your hands frequently disinfect, frequently use services, but stay home when you're ill. I also want to remind Manitobans that most people who contract COVID-19 will have mild symptoms. The majority of individuals will have mild symptoms and recover at home. Those most at risk include those over age 65, those with underlying medical conditions, as well as those with immune compromise. At this point, we need to focus on those individuals that are most at risk of serious illness. I'm strongly advising all Manitobans, including healthcare providers, to cancel or postpone any non-essential travel. The pandemic is developing and escalating with each passing day. Now is not the time for essential travel outside of Manitoba. Public health officials are recommending that anyone who returns from travel, either internationally or domestic, should self-isolate and self-monitor for symptoms for 14 days after their return. Again, strongly advising against any non-essential travel outside of Manitoba at this time. I must note that this includes people returning from long-term winter vacations. If you are returning from a long-term vacation throughout the winter, you must self-isolate upon your return. This means staying at home, staying away from other people in public. It means that things such as renewing insurance in person, going shopping are not taking place. This is going home and self-isolating for those 14 days. If you are returning from Manitoba for any reason, from any destination, please stay home, please self-isolate for the 14 days. If symptoms develop during those 14 days, please contact Health Links for further information on testing. In cases where testing may not be recommended, we are strongly advising people with respiratory symptoms to stay home until better. Manitobans are reminded that public health orders remain in effect. These orders apply to public places, not workplaces at this time. However, workplaces have and should continue to enforce social distancing policies to limit the spread of COVID-19. Recently, we've heard reports of individuals canceling telehealth appointments for medical care. This may have been done out of fear or because they thought maybe those concerns might wait. I want to ensure that Manitobans, there still are needs for medical visits, and certainly telehealth is a very safe method of doing that. Virtual care is now available to docs in the province, so I encourage you to be in contact with the healthcare providers should medical care be needed. Certain precautions are being taken, social distancing strategies are in place, but I remind people that medical care is still required for many people, and you should still follow the advice of your physicians in that regard. We're reminding Manitobans to practice the 3 Ps. Protect yourself, protect your loved ones, and protect the community. Protecting yourself, wash your hands, don't touch your face, cancel or postpone your travel. Protect your loved ones, cover your cough or sneeze, avoid crowds, disinfect surfaces regularly. Protect your community. Practice those good social distancing strategies. Please follow public health's advice if you are advised to self-isolate. We know most of the cases we've identified relate to imported cases from travel. Please self-isolate if you're returning to Manitoba for any reason. Cancel events and use reliable sources of information. So we definitely are not helpless against this virus. We see people taking steps and measures every day. We will continue in public health to escalate our response to this outbreak as required, but we have the ability to protect ourselves, protect the people around us, and to protect our community. And so thank you to all Manitobans who are stepping up to help in this endeavor, and I'll pass it over to Lanette.
Thank you. So I'm Lanette Siragusa, Chief Nursing Officer from Shared Health, and I wanted to start today by thanking some very festive people in Nipawa. We very much appreciate that social distancing and change can be hard on people. And that's why it's so important to celebrate acts of kindness in people's efforts to brighten people's lives. In Nipawa, several people decided over the weekend to turn their Christmas lights back on to light up people's moods. Residents in and around the town put on their lights. One resident even set it up so that people driving by could tune into Christmas music on the radio as they passed by. Town Councillor Daryl Gerard dreamed up this idea after seeing it being done in other parts of Canada and the United States during something similar as what we're going through. And it's another example of how small efforts can make a world of difference in improving the moods of others. So I want to say a big thank you to Councillor Gerard and the people of Nipawa for bringing us some good spirits and cheer during this time. Just to give you an update on HealthLinks, so as of yesterday, or just yesterday, they received 2,400 calls, and the average wait for the queue for the wait times continues to decrease, so yesterday was 29 minutes. New technology is also being put into place, I think today, maybe early tomorrow, so as of tomorrow, those of you who are hearing a busy signal, that should go away, and if you are calling now and you get a busy signal, keep calling because the wait is not what it used to be. Our online self-assessment tool, so far since we've posted it a week ago, has received 260,000 views. So that's great that people are going and determining what the next steps are. Community testing sites, 420 people visited the community testing sites across the province yesterday, and that brings about 4,500 people who've been screened at these sites since the first two locations opened. A new community site, testing site, a drive-through will be officially open tomorrow in Winkler at the Centennial Arena. Hours will be from 9 till 3, and this will be the 12th community testing site and our 4th drive-through. Additional locations throughout the province will also be opening in the next few days. As a reminder, these are not walk-in clinics. People need to have a referral from HealthLinks prior to going to these sites. So we encourage you to call HealthLinks, let them know what your situation is. They can help with screening and give you direction as to where to go. Remember that only Manitobans with respiratory symptoms who have traveled out of province in the last 14 days or have had contact with a confirmed or suspect COVID-19 case, such as being at a conference or on a cruise or on certain flights, need to be tested at this point. All other Manitobans are asked to stay home if they are ill. A few important notifications to let you be aware of. So diagnostic testing is looking at ensuring that that for the safety of their staff and for patients, they are going to put some limitations on who is coming in for non-essential routine diagnostic testing. So specifically, this includes laboratory blood tests, diagnostic imaging, and cardiac services. Urgent diagnostic testing, including tests and procedures required for immediate care management, of course, will continue with appropriate screening and precautions in place. This decision, again, is to protect patients and staff from possible exposure to COVID-19. Affected patients will be contacted directly and urged to immediately contact their physician if there's any change in their condition or symptoms. Appointments will be rescheduled as quickly as possible following the COVID-19 pandemic. Visitor restrictions, just a reminder that visitor restrictions are in place at all health facilities and long-term care homes throughout the province. No visitors are allowed at this time, with the exception of special circumstances. If it's end of life or compassionate care, clinical judgment, of course, will be applied. But for the most part, we are asking people to stay home and look at other options to connect with your loved one. If there's virtual options, people are being quite creative with how they talk and connect with patients in facilities. Pediatric patients as well, one parent or guardian will be allowed in the Children's Hospital. And then I just want to say that we know that that is a really difficult thing for those of you who have loved ones in a hospital or a personal care home, and it was not a decision that was made lightly. We put these restrictions for long-term safety for our citizens of Manitoba. So I just wanted to express our appreciation to you for complying with those restrictions, temporary for sure. A reminder to providers, we are reminding all healthcare providers returning from travel that they must self-identify to their organization or their staff health services to be assessed prior to going to work. And organizations who do not have their own staff health organizational services are encouraged to call our toll-free number that we have set up for returning staff, 203-4066. And that's all I have. And we can open it up to questions.
There's some time now for questions from the media. Each reporter is allowed a question and a follow-up. Then we'll move on to the next reporter, and if time permits, we'll have a second round. Reporters, please introduce yourself before you ask your question. We begin with CBC Winnipeg.
So is that CBC or CTV?
CBC Winnipeg, Bartley Kivas. We'll come back to you, Bartley, in a minute. Let's go to CHVN.
I'm right here. I was muted. My bad. Dr. Roussin, Saskatchewan has a similar population and has tested a few hundred more people than Manitoba. Why do you think they have tripled the number of cases? What explanation do you believe there is a difference between Saskatchewan having 66 cases and Manitoba having 21?
So I can't speak to their epidemiology. I haven't looked at it closely. There is a proximity, a much more proximity to a province that has been showing community transmission. They have probably more imports from Alberta as a possibility, but I haven't looked at their epidemiology well to be able to comment on that.
And I understand you're focused on Manitoba right now. At what point do we get enough returning travelers back in Manitoba that you can refocus your prioritization of tests on other symptomatic people in Manitoba? How soon do you foresee that occurring?
Yeah, it's really on the capacity. As our capacity increases, those priorities will be people with respiratory illness in hospital, all healthcare workers with respiratory illness despite their travel history, and then again those priority groups in potentially closed settings such as First Nations, possibly corrections. Those would be sort of the first priority groups, and as our capacity expands, then again focusing on returning travelers or contacts, and then at some point just all symptomatic people if we had that capacity. So I do note that the testing is important, but it is only one piece of our overall strategy. If you are sick and you stay home, whether you're tested or not, you are not going to transmit a virus. And so all of these social distancing strategies, all of the strategy put together, the self-isolation, the testing, case isolation, contact investigation, and social distancing, we need that all together to work. So testing is definitely an important piece of that, but it's not the only piece.
Thank you. CHVN 1029, please.
Hello, this is Abby Ball with 1029 CHTM. Once again, in regards to the 5 workers at kiosk, can you confirm that they have received a COVID-19 test, or are they simply just in self-isolation for the 14 days and monitoring their symptoms at this time?
Yeah, I wouldn't speak to any individuals or individual circumstances. Anyone who's eligible for a test would be advised to have it. Anyone who fits our criteria for self-isolation would be advised to self-isolate. So I won't speak specifically on individuals.
Now, over the weekend, the kiosk construction site has cut their staff by half, but the number is still in the hundreds, I believe in the 600s. So is there any concerns that there could still be a potential risk to employees at kiosk at this time?
So we have these social distancing strategies in place, and we'd expect anyone to try to implement whatever they can. Certainly, the most important social distancing strategies for remote locations is a strict adherence to the self-isolation guidelines. So people who need to be self-isolating, those returning from international travel or travel from now interprovincially, should not be intermingling in the general population there. So they'll need to be self-isolated. So that's one of the biggest factors in remote locations.
Thank you.
Thank you. Now let's move on to the Winnipeg Free Press.
Hi, it's Carol Sanders. I'm just wondering, with Manitoba having a low number of cases and so far no evidence of community transmission, wouldn't this be a good time now to say we're going to reduce the number of people allowed to gather in public from 50 to, say, 5 or 10 or even 2 like Germany? Wouldn't that be a thoughtful thing to do?
These are things that we are continually looking at, and it's consistent with our approach to be ahead of things. Most jurisdictions implemented those strict measures once they saw secondary transmission within their communities. We've maintained our ability to stay ahead of things, so those type of things are definitely being looked at.
And as a follow-up, can you talk a little bit about the contact tracing? Just what's happening with the contact tracing? What are the procedures? How many people are in one room? I know last week you said that it was a centralized operation and everyone was coming together. How many staff do you have? Do you have enough resources? And what is the process or protocol or procedure for contact tracing? How far, to what lengths can workers go to track someone down?
Right. So this is one of the many skill sets of public health nurses, is these contact investigations. So they do these investigations for all sorts of communicable diseases. So this is in their expertise, and we rely on that expertise for this. So they will be aware of the transmission dynamics, how each pathogen is transmitted, in this case close prolonged contact with a symptomatic individual. So we find out with as much certainty as we can on the day these individuals became symptomatic, and then we go through a rigorous process of looking where they were and who they came in contact with throughout that whole time. We then contact those people, and sometimes they'll provide information that we then bring back to the case to further get some leads. So it's a very extensive process, it's an exhaustive process, and it's, like I say, one of those many skill sets of public health nurses that we rely on.
Thank you. Let's move on now to the Winnipeg Sun.
Hi, this is Josh Aldridge. I'm curious about the worldwide shortage of the reagent for testing. What's the situation in Manitoba specifically? I know we're prioritizing who we're testing, but how much of a shortage is there in Winnipeg or in Manitoba in general?
Well, I mean, it's tough to quantify that. The lab always ensures it has enough for to process expected samples. So right now, you saw yesterday, they're up close to 300 tests that they were running, and they prioritize things knowing that that they need to ensure they have access to reagent going forward. So from our assessment of things from the perspective of the lab, that we'll be able to increase that number up by the end of the week, and so that's the plan. So I can't quantify what a shortage looks like, or even what a typical volume on hand looks like for that. It's just the lab is this is one of their procedures, is being able to prioritize samples to ensure they're always going to have reagent available.
Now, does the lab, from complete layman here, does the lab create the reagent, or is it centralized and dispersed throughout the country?
Yeah, so for the most part, that reagent is created commercially, and that's why the worldwide shortage has had a big impact on it. There are a number of things that the lab is available to produce, such as the viral transport media. But from my understanding, is the reagent itself is largely a commercially produced product, and so that's why that shortage is affecting us, just like other jurisdictions.
Thank you. Let's move on to the Canadian Press, please.
Oh, hi. It's Steve Lambert from the Canadian Press. Doctor, nationally, about half of all cases are not travel related. They're community transmission, according to stats yesterday from the Public Health Agency of Canada. So I'm wondering, what do you think is the reason that we're not reporting any community transmission here, and nationally it's almost half? Is it lag time in testing? Is it different standards for testing?
No, we looked exactly like those other jurisdictions look like at this point in their outbreaks. So in the jurisdictions that were first hit with cases, BC and Ontario, their first weeks looked exactly like ours. All international travel imported, right? As you get more and more introduction of the virus into your jurisdiction, then the more likely it becomes community transmission will occur. So we look just like them. We're just at different stages of the outbreak than them.
And so is it fair to expect that, it might not be an exact match, but we will see sort of a similar spike, almost an exponential growth as time passes, as there is inevitably some community transmission?
So that's what we're expecting. We're preparing for community transmission. We were given the benefit of time on this, so we were able to implement many of our social distancing strategies before that occurred. So we are doing so to hopefully flatten that curve, as they say. But yes, we should expect to see community transmission here, and that's precisely why we've moved to these social distancing strategies, and we are looking to expand those as necessary.
Thank you. The next questions are coming from Global Winnipeg.
Good morning, Brittany from Global here. Dr. Roussin, we talked to you last week where you'd asked for the closure of all gaming and casinos, but we're hearing from many people that there are still VLTs operating. Could you speak to this a little bit on whether or not that is in breach of what you're saying and what should be done?
So the casinos were closed, part of the before the orders were issued. We have the social distancing strategies in place right now, so those need to be occurring at any venue. That 50-50 rule that we have in the orders must be occurring in there. But all of these factors where we continue to look at the things that are ongoing, we're taking that in consideration as we likely move forward with our social distancing strategies as we look to further enhance those.
Also, we've talked a lot with you about community transmission, and I know before you couldn't really give us a time frame, but as we're seeing more cases, albeit minimal each day, when do we expect to start seeing a larger community transmission start to happen here in Manitoba?
Yeah, it's difficult to predict. Certainly, we just look at models of that, and a lot of the models are showing that within 3 weeks of the introduction of the virus, you might expect to start seeing sustained community transmission. But again, that's just based on models. We have, there's differences in our population. We've been able to implement social distancing strategies at an earlier time just because we've been given that opportunity of time. But that's typically what we see from a lot of the models.
Thank you, CTV Winnipeg. Your questions, please.
Hi, Michelle from CTV. I'm just looking for some confirmation about the Fort Garry Access Center. So someone said that they received a phone call claiming that all the tests at the site had been spilled somehow and that they would have to come back because the tests were compromised and they needs to be done again. So did this happen? What do you know about it?
What I can comment on that was that less than 10 specimens did have some leakage in transit. And the typical approach to this, the policy is that if there is any leakage detected on a specimen upon receipt of at the lab due to safety factors, they don't process it. They then just recollect it.
So was there any delays in getting those tests done? Like what kind of was the fallout from having those 10 samples kind of destroyed?
All of those individuals would be contacted to be retested.
And has that been done? Sorry.
That's what I'm aware of. That they've contacted those individuals to repeat the test.
Thank you. Let's move on now to CJOB.
Good morning, Diana Foxwell from 680 CJOB. Dr. Roussin, you mentioned obviously lots of snowbirds coming back, potentially from the States. What's the ideal scenario for maybe an older couple who's coming back from Florida? They haven't been in their house for a couple of months now. They don't have any food, obviously not wanting them to stop at a grocery store. Can you run me through the ideal scenario for them kind of getting to the airport here in Winnipeg and getting home with minimal contact? Do they get a cab? Do they get maybe a friend to bring their car so they can drive it home themselves? What does that look like?
Right. So the transportation, certainly not. I would advise against public transportation, but things because this is again spread from symptomatic individuals through close, prolonged contact. So a taxi, not really an issue. If they had a friend to pick them up and drive them straight home, this is good just to maintain that social separation, that 2-meter separation. If they were symptomatic upon their return, I would advise they call Health Links and be seen for testing. But the self-isolation, yeah, it's to be at home in the most direct way possible. Perhaps call ahead to friends or family to have some of those supplies there for them waiting. Delivery services, any of these factors. But the idea is we know many of the cases in Manitoba are imported. We know there is community-based transmission in the U.S., and so we are strongly advising, and like I said, it's not really just asking. It's if people are putting the public health at risk, we could issue orders. So these individuals are directed to be at home and all those other things to try to find a method to get that done ahead of time.
And just as far as the diagnostic testing changing, so my understanding is it is just the urgent cases, urgent patients who are still able to get those tests. What would make someone who's maybe wouldn't be able to get that testing done at this point turn into a case where you know what, we do need to do blood work now? What are some of those examples?
Question. So they would contact their physician if they had any changes. So this was done with clinical guidance. So tests that we think can wait will wait, but that doesn't mean that that's a hard stop rule. If people need to be reevaluated, then we can certainly do that. So certain chronic diseases where we check all the time just to keep an eye on people, we will delay certain ones, and it's specific tests for specific individuals.
Thank you.
Thank you. CBC Radio Canada.
Hi, yes, good morning. Patrick Foucault from Radio Canada. So just a question about some reports we've had of people saying they saw cashiers at grocery stores that are using surgical gloves when handling products. Basically, can you speak on the effectiveness of surgical gloves as a prevention measure?
So typically this personal protective equipment such as gloves or masks, we're not recommending it for use in the general public. I don't think there is really any benefit to that. There's a lot of benefit to frequent hand hygiene, washing hands frequently at those type of stores, to have hand sanitizer probably after each guest, and then to wipe down the surface frequently. I would not recommend gloves at this point.
And maybe as a follow-up question on another topic, how close are we in Manitoba to take a decision like Quebec and Ontario did yesterday to basically suspend any non-essential services in the province?
These type of issues are constantly reevaluated. So we are looking at all of our options to limit the spread of this virus.
Thanks.
Thank you. Let's move on to round two now. CBC Winnipeg.
Ms. Siragusa, yesterday you talked about changes with home care screening and the screening that would be done on the phone and then at the door. The union QP, representing about 65 home care workers, says it's getting daily complaints. It's not aware of this, and it doesn't have the protective equipment for its people. Can you comment on what kind of measures are in place to ensure there is protective equipment for these home care workers?
Yeah, so we have been posting all our information online, and we are just, as things change, we will pull them down and revise. So recently with the changes in interprovincial travel, we are updating those documents, but we will have those back up. And we will continue to be adapting them. So any employees, staff can go onto the Shared Health website and get the information as we update it. And as far as the personal protective equipment, I can ensure you, because we check on this every single day, that the supplies are being delivered to the region. I suspect in some areas, because there's geographic challenges in rural and northern, that we're going to have to talk about a better way to make sure we distribute it to the providers who are going out there. But it is available. We have surgical masks and gloves and gowns and everything that they need. So if they're not getting it, they should be talking to their direct reports, their managers, and making sure that there are arrangements to make sure that's a really fluid process.
Follow-up question is actually for Dr. Roussin. You last week, when asked about asymptomatic transmission, you said you were not as concerned about it yet. There has been a little bit more information since then. How concerned are you about asymptomatic transmission prior to people perhaps seeking medical attention or deciding to isolate at home, or after a 14-day period, since we know it's assumed now that the virus can still be transmitted after people's symptoms clear up?
So a couple questions there. So the asymptomatic transmission, we do hear more and more in the literature that It's a possibility. I would say that still the predominant form of transmission is close, prolonged contact with symptomatic individuals. Certainly there's a possibility that there could be some asymptomatic spread on. And again, our social distancing strategies take that in consideration. Right? If the social distancing strategies do not only apply against people who show symptoms, right? It's nobody should be attending large events. We should maintain that 2-meter separation from all people in public, not only people who are showing symptoms. So there is that that strategy in place there, and so we'll continue to monitor the developments. But we have things in place now that do deal with that. As far as the people who have recovered, positive cases who have recovered, the most recent evidence shows that after 10 days since the onset of symptoms and being asymptomatic, they're no longer going to transmit that virus. There are studies that show the persistence of the virus with the molecular tests. But again, that does not mean infectivity. When we do the studies on culture, actually looking for viable virus, after 10 days, there is no viable virus there. So we will be moving that any individual confirmed case who is now asymptomatic and we'll use the safety factor of 14 days, they are going to be cleared.
Thank you. CHVN, if you're still there, you're next.
Hello, no further questions at this time, thank you.
Thank you. Carol Sanders, Winnipeg Free Press.
Hi, so I'm wondering, Dr. Roussin, about the bulk buy that was announced almost 2 weeks ago, the National Consortium. Have you heard anything about what's happening with the personal protective equipment that is being purchased and when Manitoba is going to start getting some of it?
Yeah, we're in contact daily with our federal partners, and so we're getting updates. I don't think I have a specific ETA of this. There's going to be multiple delivery times for multiple different products, but we're following that daily to ensure that our supplies maintain.
Yeah, and I think this morning in our conversation with logistics, some personal protective equipment is starting to come in already. So it will come, $35 million of supplies will come in over time.
Okay. And just a follow-up for you, Lanette, about yesterday when we were talking about ICU and bed capacity, you said that there was less than 80% of beds in use. Is that because elective surgeries have been canceled?
No, those weren't surgery beds. Those were medicine and critical care beds that I was referencing. So it could be from a lot of different factors. It could be because some of the ambulatory clinics may have closed and are going virtual. It could be that people aren't going to work and they can take care of their loved ones at home. So it's variable and it's multifactorial. But I would say too, as Dr. Roussin mentioned, that there still is RSV and influenza floating around as well. So, you know, we're ready for anything if it comes into the hospital, but we're in a good place now.
Thank you. Next up, Josh Aldridge, Winnipeg Sun.
If we're bracing for community transmission, why do we put a timeline on the return to school? Why are we still saying 3 weeks, or I guess April 10th? Is there at some point that we look at just, you know, maybe we should better hold off until this thing passes completely before we start putting kids back into schools, kids back into daycares?
Absolutely. That was announced initially, and so we're reviewing that, and all of our decisions are going to depend on the dynamics of what we're seeing right here. And so if we are still seeing sustained community-based transmission, then we're going to act accordingly.
And do we have a total count of the number of people who've been tested? I know at the you said how many tests have been done at the community testing sites, but including hospitals in Manitoba, do we know how many people have been tested?
Yes, as of yesterday, it was 4,520.
That's including at hospitals, not just community testing sites?
Tests.
Total COVID tests.
Okay, thank you.
Up next, Steve Lambert, Canadian Press. Steve may have left the line. Winnipeg Global.
Good morning, Brittany here. Dr. Roussin, if we're looking at 3 weeks possibly for community transmission based on other models, we've already put in stricter social distancing quicker than other provinces, but why not go one step further now and start closing our borders, seeing as we see Saskatchewan have a much larger number of cases and Ontario?
Right, so we certainly did implement the interprovincial travel and the 14-day self-isolation. So we moved that to that. Certainly, closing borders is logistically quite different and probably not necessary to close interprovincial borders. But certainly, we want people returning from outside of Manitoba, with those notable exceptions, to self-isolate for 14 days. And we have these public health orders in place, and we are reviewing those continuously, and we probably will be looking to expand on those orders to ensure we stay ahead of things.
Based on that, are we looking at possibly imposing fines for people who are not following that self-isolation?
Well, the Public Health Act right now allows us to write orders on anyone who's putting the health of Manitobans at risk. And then to violate an order is an offence under the Public Health Act, which could come with such penalties. So again, we want to just get the message out. We want Manitobans to start, we're all working together. You've heard it, we're all in this together. And I think now is that time to not focus necessarily on fines or penalties, but really how Manitobans, we can just all work together to limit this, the impact of this virus on our province.
Thank you. CTV Winnipeg, please.
Hi, yes, it's Michelle from CTV. Dr. Roussin, on Saturday, you encouraged people to get outside and go to the park as long as they practice physical distancing. That excludes people who are self-isolating or living in large buildings or those who have confirmed cases. Could this change once there is community transmission in Manitoba?
Well, it depends on how we look at it. To get outside, and if you're at a park, walking along a trail, and you're able to maintain that social distancing, well, that's likely not going to change. If we see, packed parks where social distancing just can't occur, then that concerns us. And so it's all, we have to keep these what we're doing here, right, is that this virus is transmitted through close contact for prolonged periods. And so if we can limit that close contact, we are interrupting the transmission of that virus. And so no matter where you are, if you can stay and keep that distance between other people, then we're interrupting the transmission. Certainly people who are self-isolating, we want them to self-isolate. But other people, you can get out, get that exercise in, need to be strictly adhering to the social distancing strategies. And then people at increased risk, certainly those people at increased risk, you might want to take extra caution and probably stay home as much as you can. If you're in that age group of 65 or older, immune compromised, underlying medical conditions, you want to take even those extra steps to protect yourself.
Okay, and this one's for Lanette. With the diagnostic changes, so is this will already scheduled appointments be canceled? Will people be contacted? How do people know if this affects them?
Yeah, that's a good question. People will be contacted. So if you don't hear anything, you should go for your test as scheduled.
Thank you. 680 CGOB.
I completely forgot my question, so don't worry about me.
That's okay. CBC Radio Canada, Patrick Foucault.
Yeah, same for me. I've asked all my questions. Thank you.
Thank you. With that, we'll open it up, please.
Just remember, sorry. Oh, sorry. Sorry, Diana, 680 CJB. Yesterday, the Manitoba School Boards Association put out a memo asking that schools close their playgrounds and play structures. That obviously is coming from the School Boards Association. What is your reaction to that, and should we maybe have done this sooner?
Well, I mean, I think that, looking at when I see individuals, organizations taking the social distancing message seriously, I think it's good. It's seeing that this is important messaging and people are doing some actions to how they see fit. There's a balance with all these things, and so certainly if social distancing can't be achieved at these areas, then that's a measure that they could take. And then certainly concerns about cleaning these structures. But then there's also that balance of people getting out, finding things to do, staying active on it. So, I think that was a decision they made. I think that people are taking this social distancing messaging seriously, and that's an example of it.
Brittany from Global here. I know that the priority is getting back to people who've tested positive, but we're still hearing from a lot of people who have, had their tests done 7 days ago and still haven't heard. How quickly are we getting back to people who may have tested negative, and so they can know their results?
We are working on a short-term and a longer-term solution for that. So I will hope in the next day or so we'll be able to share some information and get back to those people as soon as possible. But I think we can say fairly confidently that if you haven't heard back, you're not positive. That doesn't mean you shouldn't still stay isolated, but we have been contacting the positive patients as soon as we see those results.
Bart McKeevis, CBC. We just heard about 2 paramedics in Quebec that have tested positive for COVID-19. Are there plans to equip paramedics and all healthcare workers who are taking the nasopharyngeal test swabs with N95 masks?
Yeah, all our paramedics, I believe, have N95 masks because they never know what situation they're going into, and sometimes they don't have the opportunity to ask questions and screen. So they have their personal protective equipment with them.
So we'll just note that the N95 is typically used for the aerosol generating procedures, which taking a nasopharyngeal test is not one of them. So for just the taking of an MP swab, we do not recommend N95s. We want to use N95s for the appropriate circumstances.
Thank you for clarifying that. Yes.
Hi, it's Carol at the Free Press. I just have one more question. Do you know of the 21 positive cases, how many, if any, have recovered, if you can classify them as recovered?
Right, so we're looking to begin announcing that later this week. So our definition for a community case going forward will be somebody who is 14 days past symptom onset and without symptoms. So they won't require any further testing. They will just be deemed recovered and taken from isolation. And so this Thursday is the day 14 of our first test. I'm not certain on when their symptoms developed, so that could be sooner, that they would be removed. And so we're looking at this week being able to start reporting on recovered cases.
It's Michelle from TTV. The case that was announced today, is that one travel related, or where are you with the contact investigation?
Yeah, we're early on the contact investigation. I can't link that to travel at this point. Many times we can say that they're linked to travel really early because it's written on the requisition. Often when we're getting the report, that's all the information we get is just what's written on the requisition. So they'll sometimes write the date that they returned and the place they returned from. So it's very easy for us to link it. On some of them, that information isn't provided, so now we have to reach out to the individual and do that kind of tracing, so I haven't heard back yet.
Diana from
Getting ready to wrap up.
just quickly.
Any more questions?
Just one quick last one, Diana from 680 CJB. Lanette or Dr. Roussin, what would you say to Manitobans who are afraid right now and who are just kind of scared of the situation?
Well, I mean, I think that we want people to be aware of the importance of this. But there's lots of things to consider here, that 80% of individuals who contract this virus fully recover and don't require even hospitalization. We want to get that message out that we are not just sitting back and helpless and waiting for this virus to do its to run its course on us. We have measures in place right now that are going to limit the effects on Manitobans. We're going to try to flatten that curve, and we have these in place because of that benefit of time we have earlier than many other jurisdictions have been able to. And so we're not helpless. Everyone has a role, and if they're having that fear, I think it's a normal response. But go to credible places for their information, learn about it, and I think we can all get through this together.
And I would just reiterate that the public can have confidence that the healthcare providers and the system are working really hard. We've been lucky that we haven't had any community cases to date because we've just had that much more time to be prepared. But it is going to take the efforts of all Manitobans to keep that social distancing, to keep washing their hands. And so whatever comes, we're going to be prepared, but it's up to all of us to do what we can to minimize this.
Thank you, everyone, for participating. That concludes today's COVID-19 briefing.